Asked to give you a speech and an update is Grandma Green, Flora Green, who is an individual who's going to talk about Medicare. She's a feisty little lady, and so I interrupted her.
Kind of like you, Tommy. Hi, Flora. Where are you from?
Salt Lake City. I met you in Salt Lake City.
Of course.
I'm Barbara's boy.
That's good. Thanks for coming. I thank you all for coming, by the way. I want you to know that economic security relies upon good health security. The two go hand in hand. And we understand that. And I want to thank you for sharing your ideas about how to make our society better for all of us. Flora, thanks for coming. I'm interested.
Well, thank you, Mr. President. Thank you, Mr. Secretary. This is a great opportunity because I want to speak for the heart of America, for the senior citizens that are suffering, who want action now. We don't want to wait 2 or 3 years. Like I say, I get up this morning, it's a good day. But I don't know. I see many of my fellow seniors that have difficulty in getting up in the morning. They're tired of waiting. They want this to be handled now. But there's some other issues too. Those of us, and I'm finding about 3/4, maybe not quite that much, but 60% of the folks have a plan in place that they want to keep.
Yeah.
We want to make our own decisions. We're capable of doing that. I want to keep the Medigap insurance that I have that came as a survivor benefit. One of the other issues that we're hearing, why can't we have tax credit for the premiums that we are paying for our Medigap insurance? Why can't we have tax credit for the over a certain benchmark of prescription costs? These are things that seniors need and need now. They need to cut in the paperwork. I had a woman bring me a stack of papers like that. I said, don't show it to me because I don't know how to do it either. And it's really true. They just get confused. I didn't make a lot of notes, thank goodness. But sorry. But another thing that came up that I thought was tremendous, and as I said to the group, I have 24 grandchildren, 17 great-grandchildren, 10 of my grandchildren are not married, so heaven knows what this is going to lead to. But I'm concerned about their future. Every bill that gets passed today has impact on these many beautiful little children to come into my family.
Grandma Green, thank you very much.
Thank you.
Thanks for coming. Medicare is a very important program. However, it has not changed with the times. And that's a fact. And the fundamental question is, how do we change it with the times so that seniors get the benefit of modern medicine and they get to choose? It's one of the interesting debates in Washington is, should you be allowed to choose?
Absolutely.
Well, I think so too, but others don't. Others want the government to make those decisions for you.
Why should some bureaucrat tell me what to do?
Be nice now, Grandma.
Have you ever been to Washington?
I get past those watchdogs that protect the members of Congress. Those 29-year-olds that are running the country.
Mr. President, I'd like to move on to more patient control, and I would call upon Lucinda Harmon to give you an update.
Oh, hi, Lucinda. Thanks
Hello.
for coming.
Thank you so much, Mr. President, and thank you also for your Promoting Independence initiative while you were governor and the executive order. I greatly appreciate that. And thank you, Mr. Secretary, for the Systems Change Real Choice grants that are currently being funded to the states. They are helping greatly. There are several issues that are involved in the community of people with disabilities and the aging community because they are overlapping communities greatly. First off, we need more choices for long-term care, and it needs to expand to the entire continuum from facility all the way to the community-based services. And no matter how much public money is thrown at this issue, it will not be resolved without a public-private partnership. There is no way that federal money can accommodate individual community capacity. It has to be an integrated approach. Without the community involvement, there won't be community investment, and with it, community capacity will be built. And it will be built in the areas that it's needed, not in the areas that somebody else might think it's needed. Taking that on and extending it to the individual is absolutely critical, because individuals know what is needed for their own lives. We know how we need to be supported, and the way I need to be supported is not the way Lex needs to be supported, and not the way Grandma needs to be supported. This is a totally individual world. We have an individualized nation, and we need to progress that direction with our support of people with disabilities and people who are aging. We also need to take the income limitations off of all of our programs for people with disabilities. I want to pay taxes. You don't hear that often. Make note. I want to pay taxes. I want to be allowed to earn the income and still not lose the benefits.
Yeah.
I'm a well-educated person, but I cannot possibly afford the medical care that I require, the equipment that I require, and I want to be able to earn the money to be able to do this, to be able to contribute to it. Thank you so much.
Absolutely. Lucinda, where are you living?
I live in Salado, Texas.
Oh, yeah. Right down the road.
Yes, sir.
And what are you doing?
I am an educational consultant. I build capacity in terms of community coalitions and grant writing. My company has brought in $2.6 million into the state and in the area, and I make $40 a month.
So you can get your Medicare benefits. Yeah.
And Medicaid.
And Medicaid, right?
Yes. And
Actually, we made some progress on the Medicare
We are making progress.
in terms of income limitations.
That's weird. Well, Lucinda would like to introduce her dog, too.
yes, my dog is part of my personal choice. His name is Quint Essential. Quint, baby, wake up. Come here. Meet the president.
Where is Quinn?
Quint, you're up. You're up. Come on. All the way.
Let me say
You're
it.
up. You're up. Come on, I know you're stretching. You're up. He'll go up. Quint. 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 He's a part of my individual program. Thank you so much, Mr. President.
Mr. President, I
He
know
was afraid
the,
I was going to give a speech.
Mr. President, the next issue that you have a tremendous passion for is reforming the tort system.
Yeah.
As far as medical malpractice, and I'm going to call upon Dr. Hill, who's the head of the American Association of Physicians.
Thank you, Mr. President and Mr. Secretary. I thought I came here to be on your team, but I think I'd rather be on Flora Green's team right now. America's patients and physicians are facing a crisis, and I've heard this morning many times it's a malpractice crisis. It's not a malpractice crisis. We have a liability premium crisis, and I wish I'm going to try to teach Secretary Thompson not to say malpractice crisis before the day's over. It's a liability premium crisis. Well, these litigation costs are driving jury awards totally out of control. And they're forcing doctors in many states to do several things: leave practice, retire, go into another profession, or move to another state that has a more reasonable liability climate or where the insurance market's a little bit more stable. And this is not the first liability crisis we've had. This is the fourth one since 1974-75. And physicians and others in the healthcare system have looked at it, and we've been offering solutions to the problem, yet in the great part of the country they've not been adopted, and of course we're in a crisis again. Trial lawyers have fought us every inch of the way, every step of the way. They've pointed the fingers to blame everybody except themselves.
But your association, Doctor, has got to be with the President of this administration if we're going to win.
Absolutely. Last month, Nevada closed their level 1 trauma center for 10 days. I often think of what if I'd had a child in a wreck out there at that time. Across the country, many women with good insurance are unable to get prenatal care, unable to get delivery care because OBs and family doctors have reduced the number or stopped delivering babies entirely. And in addition to that, a lot of the advanced procedures are just not going to take the risk of doing anymore because they can't find insurance to cover them. So we got states that have out-of-control legal systems and skyrocketing liability premiums. More than 100 physicians have left the state of the states of Nevada, West Virginia, Pennsylvania, and Mississippi in the last 6 months. 81 have left Mississippi. 39 of those left because of liability, the premium crisis. The rest retired, but they retired before time that they were planning to retire. And those doctors aren't coming back. Governor Gwynn and the Nevada legislature had some guts, and they passed some liability. Real leadership was shown there, some meaningful liability. Radiologists in New York and Pennsylvania and Florida are no longer reading mammograms because of the risk, and they're afraid they're going to be sued. And then there are a whole lot of other states in crisis. Georgia, New Jersey, New York, and Texas are crisis states for us. And there are many others that crisis is looming. 1994, the median jury award in America was $375,000. Six years later, 2000, $1 million. That's a triple in the median jury award. In Nevada, it took 23 cases to destabilize their insurance market and precipitate the crisis. 23 cases that are responsible for 65% of the non-economic damage awards. 23 cases, 65% of the non-economic damage awards. Now, we know from research and experience that most of the cases are frivolous, but they cost taxpayers a lot of money. A recent report from the Secretary's Health and Human Services showed conservative estimates of the annual costs of defensive medicine, $60 billion. Conservative. Also, the report pointed out very clearly that non-economic damages, with reasonable limits were put on non-economic damages, and taxpayers would probably save around $30 billion by reducing federal health care spending. That's a total of $90 billion. So the present system is obviously quite broken, and America's patients need to know that when they need medical care, it's going to be there. California patients have had that comfort for more than 25 years, and it's working in California, and the rest of America needs it too. So the AMA supports President Bush's proposal, and particularly for the best speech you've ever given in Mississippi last week. That's a personal opinion, but it was well. It was done extremely well, and many doctors who we talk to and we say, well, we're going to get liability reform, but it's going to take 2 to 3 years. They've got to have. They say 2 or 3 years is too late.
Yeah.
We need some hope.
No, we got a real problem, and what Americans got to understand, the medical liability problem affects them for 2 ways. One, it runs up the cost of medicine. It just does. Large settlements and or frivolous lawsuits makes your health care go up. That is a fact. And secondly, the liability situation denies some people health care. I met this guy from Mississippi. He's a fellow that came down from Minnesota, he and his wife. They're pediatricians. They heard a calling to go to a poor community, and now they're leaving Mississippi. They're in the Delta, and they're leaving because the lawsuits are driving them out. Not only does the system drive up the cost for the people in the Delta, the poor people can barely afford it, now they don't have a pediatrician, or 2 less pediatricians. And it's sad, and we need to do something about it. These liabilities, these lawsuits drive up the cost of medicine. It drives up the cost of medicine to the federal government as well. Medicare, Medicaid, Veterans Health Benefits. So therefore, I believe the federal government ought to act. And we ought to have medical malpractice reform across the board. People ought to be able to recover their economic damages. If you get hurt, if somebody's mistreated you, you ought to have your day in court, and you ought to be able to recover, what they call economic damages. People ought to be allowed to be treated fairly. But there ought to be a cap on non-economic damages and on punitive damages. And we ought to have joint and several liability reform. This is a real problem. And I call upon Congress, Doc, and I call upon you to get the people in Congress to act, to understand the crisis. There's a lot of good docs who aren't going to be docs anymore, and people suffer. And that's not right. And so it's time to act on this. I agree with you completely. And there's the other thing people got to understand is these frivolous lawsuits, and there's a lot of them, not only run the cost of medicine up, but denies people a chance to get their day in court. And that's a problem. And so we need to move. For a while, I thought that it ought to be done at the state level. When I realized the cost to the federal treasury, I now believe we ought to have medical liability reform at the federal level. And I'm going to push hard for it. And I need your help. And the trial lawyers are very politically powerful. And they're strong. But here in Texas, we took them on and got some good medical malpractice, which evidently had a few loopholes in it.
Yes, sir, it did.
But we got some good tort reform across the board, and we need to do it here. We need to do it now in America before it's too late. The patients get hurt, and the docs get hurt. And one of the things we got to do is make sure the connection between the doctor and the patient is strong, and that it always remains intact. Because that's one of the great things about our medical system. And anyway, thanks for bringing it up.
Thank you, Mr. President. You got time for one more subject?
Yes.
I'm going to call upon a businessman, David Ness, to talk about how difficult it is with health insurance and what they're trying to do to make sure that they have health insurance for their employees. David?
Thank you, Secretary Thompson.
Where do you live, David?
Minneapolis, Minnesota.
Good.
It's a suburb of Wisconsin, Mr. President.
He tried that line in Minnesota, by the way.
Like Wisconsin, we have 3 days of summer. I work at the great pleasure working for a very good company, a medical device company that provides solutions for people with chronic disease. And we have over 20,000 employees in the U.S. Our medical expenses are over $81 million. They're increasing significantly. However, we've been able to, through, I think, rather creative approaches, arrest that increase. And the model, we think, provides the greatest opportunity is consumer-driven health. It's a defined contribution medical plan that we offer in conjunction with other plans. The reason why we believe this will work is threefold. Number one, it really changes the way we deliver health care. It puts the patient, the employee, the family at the center of that decision making. They, in partnership with their doctor, are determining what's the best care. It's them, not the plan, that decides what the care should be. Secondly, in order to do this, you have to have good information. There's a lot of information out there, but very little of it is really delivered in a way that employees can use it, patients can use it to make the best care. So we have a model where every employee has their own website, and that website has data that they loaded on their own health history. It has access to Johns Hopkins Medical Library. It has access to credentialing of doctors they might want to go see. It has access to prices for drugs. It's having good data that allows these people to make the right decisions. The third thing is economic realignment. The current system is really not right. On most plans, someone goes in for a major operation, they think the cost is $100 for the exam. No, there's probably thousands and thousands and thousands of dollars. It's crazy. Our system, every employee will see every cost that was spent on them. The cost of the doctors, the cost of the nurses, the cost of the hospital. Because then we think people are using that money wisely. And most importantly, every employee has a personal care account. Dollars that they spend, and I thank you. We made a bet 2 years ago that this administration would do something, and he did something, allowing that personal care account not to be taxable, but to roll over as long as it's used for medical care. So by doing those three things, we think we've changed the system to make the employee at the center of their health, investing in their health through preventative care and through spending their money wisely.
Yeah, medical savings accounts, whatever you want to call them, are very important for providing proper incentive and keeping the relationship between the patient and the doctor. I hope that Americans understand that if they walk 20 minutes a day, they get out and exercise, the amount of money they can save for their families, that there is such thing as preventative care, and by making right choices, that people can really save a lot of money, and that if the system encourages those savings, that in itself is just as well. I appreciate you bringing that up. We've kind of lost sight of who's responsible for what. Part of it has to do with the size of government. Part of it has to do with the health insurance phenomena that has taken place. The notion is to kind of, as we talked about, individualized medicine. But as you individualize medicine, individuals have to make better choices too, and that's going to be crucial for the future of the country. Listen, thank you all for coming. I promise you I will listen to what has been said here, even though I wasn't here. And we will distill the ideas and the comments. This is an important subject for the country because as I mentioned earlier, good health care will yield to better economic security. It's hard to feel economically secure if you're worried about your health. it's hard to feel economically secure if the healthcare systems don't enable you to really realize your full potential. And so the ideas that you bring forth are important. Tommy's doing a fabulous job at running Health and Human Services. It's a Health and Human Services, the budget and the amount of influence it has on our society is enormous. And Tommy's a good listener, and he's a pretty good actor, too. He can get things done. Action man, we call him. And, but I want to thank you all for coming. I think you'll be impressed by the quality of folks who've shown up here. I don't know if you've had a chance to mingle, but I've been very impressed. I've been very thankful that a lot of our national experts have come to talk about a variety of subjects. Really what we're talking about is confidence in our future. I've got great confidence in the future of our country because I understand America. I know what we're made out of. And obviously we got some problems we got to address. But one problem we don't have to address is the fundamental character of the country. The fundamental nature of the American people are resilient and strong. We talked a little bit in these other seminars about how some have let us down, have cheated, and didn't tell the truth when it comes to their numbers on their balance sheets, and we'll find those and hold them to account. But by far the vast majority of Americans are really decent, honorable people. So thanks for coming to Central Texas, and I know it's a lot to ask to come here in the middle of August, but it's worthwhile. It's worthwhile. God bless you all.
Thank you, Mr. President.
Thanks, guys.